Are you able to diagnose cancer of the pancreas by special tests?
Yes, you can. Well, typically the very first thing that is done, especially if there is a change in the skin color, liver enzymes are often drawn early, and if they are elevated, that will give you a clue. After that, there's typically imaging that is done, including a CT scan, an ultrasound, or an MRI.
So let's talk about the diagnosis. If somebody comes to you with belly pain, weight loss, back pain, elevated liver enzymes, why would you get liver enzymes?
Because as the liver is draining, and it drains through a bile duct, which is the tube that carries the things that your body doesn't need anymore, and also bile to help break down fat, that if the tumor in the pancreas is compressing that bile duct, the liver enzymes will elevate.
Ah, so it could be an early diagnosis that way. Let's talk about imaging. What imaging do you get first? Do you get routine CT scans first?
Usually I will go to a CT early in this situation because it is such an important process to make a diagnosis early.
So what do you see on a CT scan?
So oftentimes you will see a mass in the pancreas, and then sometimes you will see that the bile ducts are actually swollen or dilated.
Whoa,
inside.
so you can see the bile duct swollen on a CT scan?
Yes.
Are there special CT scans now that we can use, or what about an MRI?
So both of those tests are very helpful for that. There are CT scans that you can use special different imaging types to get a really dedicated view of the pancreas duct. And then an MRI oftentimes will pick this up as well. And then plus with the MRI, you get very detailed evaluation of the ducts that drain the pancreas that carry those juices to the bowel, and also the duct that carries the bile from the liver.
So when I see reports from a radiologist, or when I look at x-rays, they say always compatible with, suggestive of, maybe you have. So you have to go down and you have to really find out if that's the case. Is that right?
Absolutely. And then they'll oftentimes strongly word these as well. Our radiologists will say highly suspicious for a process like that.
So if it's highly suspicious, what do you do to help the patient? How do you carry the diagnosis further?
So the next step usually is trying to get a tissue diagnosis, or actually getting a piece of this cancer to actually confirm that that's what we're dealing with.
How do you do that?
So it really depends on the symptoms that the patient has. If they are yellow or have liver enzyme elevation, then oftentimes the very first test is what's called an ERCP.
ERCP. So what's the long word for that?
So it's endoscopic with a scope. There's no cuts on the outside. Retrograde, going back towards the liver or into the pancreas duct, and then cholangio, which is the medical term for bile duct, or pancreatography, which is the medical term for the pancreas.